Thank you for joining us on this program today, and thank you for taking time to be with us today. This program is streamed on FEBA Online and FEBA India YouTube channel. World Lupus Day is observed every year on the 10th of May to create awareness and to talk about its devastating effects. Today we have experts with us to help us gain understanding and insight on this disease. Dr. Jacob Mathews V specializes in rheumatology and is with Bangalore Baptist Hospital for the past 11 years. Prior to joining Bangalore Baptist Hospital, Dr. Jacob worked as a clinical tutor in clinical immunology and rheumatology at CMC Bangalore. We have Dr. Silas Vinay. Dr. Silas has completed his post-graduation in general medicine from CMC, Ludhiana, and postdoctoral fellowship in rheumatology and clinical immunology from CMC Bangalore. Dr. Silas is experienced in managing and treating patients with various connective tissue and autoimmune disease. We also have Dr. Asha Sujatha. Dr. Asha Sujatha has been working as a medicine consultant for over 7 years. She has a special interest in the field of rheumatology and has been part of the rheumatology department at Bangalore Baptist Hospital. Prior to joining Bangalore Baptist Hospital, Dr. Asha worked in Narayana Health and Ramakrishna Mission Hospital, Bangalore. Dr. Asha.
Thank you, Hannah. Greetings from the Department of Rheumatology, Bangalore Baptist Hospital. We are here to create awareness about lupus on the event of World Lupus Day. As Hannah said, World Lupus Day is celebrated on 10th of May every year across the world because this is a disease that spreads across ethnicities, across geographical locations, across races. And the part about celebrating is to create awareness about so that more people can get diagnosed early and can seek prompt treatment. Also, this is to throw focus on the latest research that is going on in this field, and most importantly, to encourage people who are battling this disease every day. What is SLE? SLE or lupus is an autoimmune disease. It is a disease in which the immune system of one's own body attacks the tissues and the organs of the body. So autoantibodies are formed which damage the tissues and the organs, may it be the kidney, the nervous system, the skin, the joints, the eyes. So like Hannah said, it can have devastating effects on the person's body. So let's start the discussion today. Dr. Jacob, sir, what are the causes of SLE?
SLE, as we just discussed, is an autoimmune disease. What that means is that the immune system attacks the body because of certain triggers. These triggers, as we know, one is genetics. Up to 10 to 15% of lupus patients have a genetic component. How do we know that? Because in twin studies, if one twin has it, there's a 50% risk of the other twin having it. There's a risk, 5% risk of a mother transmitting lupus to her child. And even among siblings, if one sibling has lupus, there's up to 10% risk of another, especially female sibling having lupus. So we know there is a genetic component. But largely it is due to other causes, what we call infections, environmental. Infections like a common infection which most of us are not aware of, but most of us do have from our childhood is something called Epstein-Barr virus. These come and go, and most of us don't even realize it, but they trigger the immune system and cause the immune system to produce unwanted antibodies that harm our own tissues. And one of those diseases is lupus. Then environmental influences are like sunlight. Prolonged sunlight exposure in some people can cause damage to our DNA if the sun is when our skin is exposed to the sun. And that sort of creates some inflammation in our system, and again antibodies start reacting to it and cause this disease. Smoking is one of the risk factors, and studies have shown that women with lupus who smoke have a higher risk of certain antibodies which make lupus worse. Then construction sites, silica dust from construction sites. Silica dust from construction sites, from brick, tiles, concrete, is known to trigger lupus. So these are the various environmental infectious triggers for the immune system to react against our own body or our cell tissues and cause lupus.
It's a small percentage of drug-induced lupus also, no, sir?
Yes, very small percentage. A few drugs, especially certain DP medications, but they are almost literally unheard of. In the last 15 years, I have seen probably one patient with lupus.
Whenever we give a diagnosis of lupus to the patient and their families, the first question they ask us is always, is SLE curable? Dr. Silas?
Right. So SLE, as you know, is a long-term disease like most other autoimmune diseases. Like other autoimmune diseases, it runs a varied course. It will have waxing and waning course where you can have severe symptoms during some time and you can have probably less symptoms in other times. The thing that you need to understand is that like with other chronic or long-term diseases like diabetes or hypertension, with regular monitoring and proper follow-up, you can have a good or a normal, near normal life. And that's one thing that you need to understand. Especially like in this age of internet where most of the patients would Google things like lupus or SLE, and the first thing probably that would come up is probable end-stage renal disease or a stroke. You should understand that like cough with blood, if you Google that, probably you'll find TB or malignancy as your first differentials. Cough can be seen as in multiple other causes. So similarly, all lupus is not very severe and it is a varied course, and the range can be from a simple skin involvement to end organ involvement where a kidney or a brain is affected. That's one thing that you need to understand. The second thing also that you need to understand is that with recent advances in treatment, especially new molecules and better research-oriented treatment aspects that have been coming in the recent years, most or in fact all complications of lupus can be treated. Though the disease itself probably you would say is not curable, but most of the complications and also the organs that are affected can be controlled.
This is what we always tell our patients, that it may not be curable, but with good guidance, good medications and good follow-up, they can lead a near normal life. And like Dr. Silas said, the ongoing research is bringing up newer molecules which will help fight this disease better. So no need to be disheartened, no need to be despaired. There is treatment available which can help you lead a near normal life. So going on, what are the signs and symptoms of SLE?
Yeah, SLE is, because it's quite rare, we need to look at a combination of symptoms in the appropriate population. So if a young lady or a woman of a childbearing age comes to you or comes to a doctor with symptoms of joint pains, prolonged fever, rashes in sun-exposed areas, breathing difficulty, chest pain, a combination of these symptoms, then the physician would think of a autoimmune disease like lupus. These are the more common symptoms. There are rarer symptoms, but you would start investigating if you see such symptoms in the appropriate population.
So like Jacobs has said, these are the signs and symptoms that you should watch out for. If anybody has, that is the most important point about this talk, creating awareness among the people, that if you have these symptoms and signs over a long-standing period, please meet a nearby physician so that they can screen for possible lupus and can direct you towards a rheumatologist. So moving forwards, like Dr. Jacob said, that it is more common in women of childbearing age. So we have a lot of patients who come to us with a lot of doubts about is it possible to conceive, what happens during pregnancy, what care should they take, and what are the complications that can come with pregnancy in lupus. Dr. Silas, would you tell us?
Yeah. So the thing that you need to understand is that during pregnancy there are changes in your body that occur, some physiological changes. To put it in plain words, there are some changes with circulation because of a new being that's there in the body. And secondly, also the pregnancy is seen as a prothrombotic or a state where there is more chance to develop clots. So these are, in simple words, two changes that occur in a mother when she is pregnant. Through this research, what has been seen is that if your lupus disease is stable for the last 6 months, which means you have a stable lupus disease, then approximately in 80% or more, you will have a normal delivery without complications. That's one thing important to recognize. Another important question that sometimes patients do ask is, will my lupus flare during pregnancy? So if you already have lupus, will it get worse during pregnancy? Again, in research, it's been seen that a normal lupus patient, even on regular treatment, can have a flare. It's seen in around 30% of patients in 1 year, which means that out of 100 patients with lupus, probably 30% might have a flare. And this flare could be anything from worsening of their arthritis, worsening of their skin lesions, or a major organ that can get worse. And therefore, regular monitoring is important. What has been seen is during pregnancy, this flare is probably twice more than in a non-pregnant person. That's one thing important to understand. And also coming to the prothrombotic or the increased clotting chances that are seen with pregnancy, especially when associated with another condition called as APS or antiphospholipid syndrome. And when you have these particular antibodies that are present, then you have a tendency for the blood to clot. So what happens is mainly the uterine vessels, the vessels that supply the uterus, can get blocked and can lead to abortions. So that's one important thing to know, that if you've had recurrent abortions and you also have symptoms suggestive of lupus, you should always, ask your physician or your rheumatologist to check for these antibodies. So overall, main driving home point is regular follow-up and compliance, and to have a stable disease before you plan your pregnancy. And a little bit about contraception as it's part of the pregnancy. Most contraceptive pills should be avoided unless they are progesterone only pills. Like Sir had said, estrogen can cause worsening of lupus and also can cause increased thrombosis. So that's one thing. And trying to plan your pregnancy, including your family, your physician or the rheumatologist and your gynecologist, is important, especially when you lupus.
And another thing is that during, as Dr. Silas said, the risk of miscarriages being a little higher in these patients, they must, as soon as pregnancy is known, they must visit their rheumatologist. It should be a team approach where the gynecologist, the rheumatologist and the patient, all the visits are planned and everything is taken into account, and a smooth pregnancy is the result. So yes, it is a positive outlook. We all have had patients who have gone ahead and have had beautiful families. So that is actually very gratifying for us to see them come back to us with their little ones. So yes, it is possible to conceive and to have a normal pregnancy. Jacob sir, Hannah, you have something to ask us? Yes.
Dr. Jacob, you mentioned the symptoms that can come up in a patient. So most of the symptoms are similar to other diseases, and many of the patients may not realize that it is lupus is what they are going through. So when should they come and get themselves diagnosed or meet a doctor or rheumatologist? When is that time?
Yeah, usually the symptom that is worrying is the joint pain and the fever. Joint pains means hand joints, knees, elbows, and ongoing fever. And the symptoms go on more than a week. In the usual viral fever or so-called chikungunya and other viruses, you usually have high fever, joint pains, and you're quite well within about a week or 10 days. you do have low grade joint pains going on, but over time you get better. Whereas in SLE, you have symptoms which get worse over time, but they keep coming back every few days and weeks, and you're really not well for weeks together. It's not a symptom over days, it's over weeks and probably months. We've even seen patients coming to us after a year of symptoms because it is so low grade. It just comes and it goes, they take a paracetamol, they get better, then after a week again it starts. And the fever has no other cause. They would have done a lot of tests and they find that there's no other cause for fever.
Continuing forwards, sir, how is SLE diagnosed? How do we diagnose? What are the tests that we do?
Yeah, so the important thing is to first meet an experienced physician who will put these symptoms together, and then he will likely think about SLE when he doesn't find the usual causes for fever in the patient. And then that triggers the set of tests. And the most important test is what we call anti-nuclear antibodies, ANA. And once that is done, along with a group of other tests like blood counts, the renal tests, kidney tests like creatinine, urine tests, these few tests are enough to begin to suspect lupus. And certain findings like a positive value on the anti-nuclear antibody, the low blood counts, somewhat low platelets, may not be critically low, then high, some protein excretion in the urine which is not normal. Normally we don't have any protein coming out in our urine. So if you have a 1 plus or 2 plus urine protein value, these are the clues along with the symptoms that enable the physician or the rheumatologist to come to a diagnosis and conclude whether he may be having lupus.
So going forwards, Dr. Silas, what is the treatment options that are available for SLE?
Like I said before, in the last few decades probably, there have been leaps and bounds in the type of drugs that have been coming into the market and have helped improve the quality of life in these patients. But still the old drug which is called as HCQ or hydroxychloroquine, which has been used even in diseases like malaria, commonly without any major side effects, is probably you would say the cornerstone of lupus treatment. Because it is easily available, it's cheap, and also the side effects are very rare and few. The most common side effects, if you would say, would be retinal involvement, which you could have, but that's a long-term side effect, usually occurs when you use the drug for more than 5 to 10 years. However, we would recommend retinal screening to be done ideally before starting HCQS, especially in people who are more predisposed, probably with the diabetic retinopathy or with older age, elderly people. That's probably the most common the drug that's used. Coming to the other drugs, the other mostly used drug is the steroids which are used. You should understand, like we have already discussed, that SLE is an autoimmune disease. So the drugs that are used are called as immunosuppressants. So there is some medicines that suppress your immune system or the cells that are causing the damage. To put it in plain words, it's basically your immune system is activated whenever you have infection. That's what happens to our immune system. So when we have these diseases without a trigger of infection, the immune system automatically is activated, and that is what is causing the damage in various organs. So these drugs basically suppress the immune system. So the most important side effect to steroids is infection, which you should understand. Those steroids have a lot of side effects. They are drugs that are used depending on the severity or the organ that is affected, and they're not used over long term. Because most of the other drugs, which are the other immunosuppressive medicines that are used, have some time before they reach their peak action, probably a few months. So therefore, the initial part of the disease to bring down the symptoms, we do use steroids, especially in conditions where you have arthritis, where you have severe pain, or in major organ involvement. For example, if you have severe renal or CNS lupus, where you have brain involvement, you might need to give a high dose of steroids. I know there's a lot of hesitancy, especially with the COVID outbreak and with the black fungus and all these things. People are a little more hesitant now when we use the word steroids in our OPDs. But you should understand, I usually use this illustration to tell them, when will you get hit by a car if you cross the road? So the usual answer is no. If you are careful, we won't. So that's exactly what I would tell you when we use these drugs. Yes, they have complications, but the complications are rare, and we are giving them because we need them. So it's not because of the side effects. So with regular monitoring and regular follow-up, you can have a life where the complications are rare, and also the side effects can be picked up earlier. So,
I would just like to add that steroids are life-saving.
yes.
So when a patient comes with an important organ involved, like a brain or a kidney, not giving steroids could lead to severe damage in those organs. So steroids are organ and life-saving in the early stage of disease.
Again, one point I would like to say here is that there are certain people who indiscriminately on their own start using steroids. We have had patients who come to us who have had these symptoms for a long time, but who take over-the-counter steroids, and then we get steroid-modified forms of the diseases. And like we say that steroids are life-saving, it should be given and prescribed by the physicians, by the dermatologists. One should not go on taking steroids over the counter. That is also a bad thing. And like Dr. Silas said, that there are newer drugs available. There are steroid-sparing immunosuppressive agents which are available, and we should use them. We use it because you need them. So do not be scared checking online about the drugs, their side effects. We are giving them in a proper manner, following proper protocols. So do not be scared of using those drugs. So another question that we frequently face in the OPDs is that what is the diet that patients ask about? What diet should we take if we are diagnosed with lupus? What can we eat? What should we avoid? What can be good for our immune system? So what would you tell them, sir?
Yeah, when it comes to diet, especially in our country, most of our patients come to us with this question. Simply put, with the available evidence, we don't have any known, we don't have any recommended diet for lupus patients because diet does not trigger lupus or diet does not control lupus. The simple message would be to have a balanced diet. The only additional thing we tell our patients who are already on steroids, for example, is that because steroids themselves are known to increase cholesterol levels and blood sugars, we tell our patients who are having lupus, or in fact any of our patients who are on steroids for any other disease, we just tell them to avoid too much of sweets and sugars, even if their blood sugars are normal, because these things add to weight gain. We also tell them to avoid oily or fatty food because steroids themselves cause an increase in cholesterol and weight gain. So it's more of to prevent. It is more of advice to prevent complications due to medications that we tell them to control certain food items in their diet. But by and large, there is no particular diet to be followed in lupus. On the other hand, we do tell our patients to time their meals because we find patients with the rush of day-to-day work, they don't eat on time or they don't sleep on time. So we tell them, eat on time, sleep on time. That actually keeps the immune system calm. So there's no particular food that triggers the immune system. Although the net is full of information about lupus diets and antioxidant diets, but by and large, how many of us really look at what is the antioxidant level in our food? The basic advice is to just eat a balanced diet.
Thank you, sir. One area that I would like to touch focus now is about lupus in children. Dr. Silas, in your experience, do you come across many children with lupus, and what is is there any difference in the presentation or treatment?
Yeah, so lupus can occur even in a child. It's called as juvenile lupus, especially if it occurs in children less than 16 years. The symptoms, as you say, usually are a little more severe when compared to adults, especially in the organs involved, which are the kidneys, the brain, and also the hematological complications. where you can have anemia or low WBC counts, or the white blood cell counts. So those symptoms are a little more severe when compared to adults. And important thing to understand is steroids, though have a lot of complications, are a little more difficult to be when given in children because they can cause growth retardation also because they're hormones which actually help in growth. So that's one thing that you need to understand. However, like we had already put the point forward, where required, especially it's a life-saving medicine and has to be used when required but not irrationally over the counter or just for pains. Coming to other symptoms or in the treatment, most of the drugs that are used in adults can be used in children. However, the dose needs to be adjusted according to the body weight.
Dr. Silas spoke about a little earlier about the drugs that are used in SLE. So, like he said, drugs have their side effects, but we monitor them to keep you safe. Dr. Silas, what are the common side effects that we anticipate and we educate the patient to watch out for, and how do we deal with them?
Right. So, like I said again, driving home the point in the beginning that regular follow-up is important because most of the side effects might not be picked up by yourself, and they take time. They don't develop overnight. So, and some of them are only picked up on investigations. Again, to reiterate the point, HCQ mostly is a safe drug, except it can cause retinal involvement in long-term use and some discoloration of the skin can occur in some patients. Steroids have very multiple side effects from, as Dr. Jacob had already touched on, it can lead to increased cholesterol, your blood pressures to go up, your sugars to go up, and other bone problems like osteoporosis can develop, especially in postmenopausal patients or even in the reproductive age if you're on long-term steroids. Now, and another important complication is infection that can occur. Now, how do we combat these side effects? So, steroids, like we said, can cause osteoporosis, and therefore, most of these patients, your rheumatologist or the doctor who you're getting treated by will put you on some vitamin D and calcium supplements to strengthen the bone. And if you're on steroids for longer than 3 months, usually, then if possible or available, a bone mineral density scan might be advised to look at your density of your bones. And in conditions where recommendations also say even if you don't have, you might be on certain drugs that strengthen the bones called as bisphosphonates. That basically why? Because to prevent fractures. Because if your bones are weak, if you have even a small fall or you trip yourself, you might break your bones. Coming to infection, depending on the dose of the immunosuppression. So if you are on high dose of steroids or on medicines which are immunosuppressive, like the newer biologic injections or a high dose of other immunosuppressive medicines, the doctor might prophylactically vaccinate you against some common infections, most commonly pneumonia. So you might be asked to take a vaccine for pneumonia to prevent pneumonia. It doesn't prevent all pneumonias, but most common viral pneumonias, which are bacterial like pneumococcal and influenza virus. So those vaccines might be recommended to be used in these patients. And also infection, if you are on a high dose of immunosuppression, you might be also on prophylactic antibiotics just to make sure that infections are prevented. So usually cotrimoxazole or Septran as it's commonly used could be used in certain conditions. Coming to other complications of treatment, they are different depending on the agent that is used. Most of them are organ specific, where you will have hepatotoxic complications, you can have hematological, which is blood side effects, and these things, and probably even renal in some drugs, but these things cannot be picked up by the patient. And by the time they're picked up, by the time you have jaundice or you have decreased urine output or you feel tired with anemia, it's a little serious. So therefore, regular monitoring while on these medicines is very important. We would say initially probably once a month, and once you have a stable disease, once in 3 months would be advised.
This is again a point that we would like to stress that patients should be compliant to the treatment. They should follow the doctor's advice strictly. And like Dr. Silas said, every 3 months in a stable disease, even if you are feeling well, you must come to the doctor, do the prescribed test because they help us in picking up the complications early. And again, another point Dr. Silas stressed, very important to take the vaccinations. We have seen that it really helps in decreasing the rate of pneumonias that these patients can get while being on immunosuppressive medications. So, what about the role of physiotherapy in patients with arthritis? We always tell them to, to do physiotherapy when arthritis is a part of the disease.
Yeah, I would say a good thing about lupus is that the arthritis or the joint pains that you get with lupus does not cause any long-term damage or deformity to your joints. As a result, even with the first medication that we use in lupus, which is called hydroxychloroquine, even with the early stages of that treatment, your joint pains usually subside and your joint movements improve. So the physiotherapy is mainly done to improve joint function, which is and for which we always advise one visit to a physiotherapist just to learn the exercises to strengthen joints and to do exercise that improve strength of bones as well, both joint range of movement exercises as well as bone strengthening happens when you do exercises, and so it's a good thing as far as joints are concerned because you literally never see a patient with deformed joints in lupus. It's almost unheard of.
And so I just wanted to clarify the difference between arthritis and lupus. Is there a difference and what it is?
Arthritis is a general term used for joints. Inflammation in joints, we call it arthritis. So, most of the autoimmune diseases or the rheumatic conditions, they cause joint pains. So, the term arthritis is only a symptom, it's not a diagnosis. Whereas there are diseases called rheumatoid arthritis, that is a particular type of arthritis which is lifelong and needs long-term treatment. Whereas all other rheumatic diseases do have a component of joint pain. So SLE patients do have joint pains. Patients with disease called ankylosing spondylitis, they also have joint pains. Rheumatoid arthritis patients have joint pains. People with other viral arthritis, viral fevers like chikungunya and other viral infections, including dengue fever, they also come with joint pains. So arthritis is only a medical term for joint inflammation. It's not a diagnosis by itself.
Another point that I would like to stress is when the patients of lupus who are immunosuppressive drugs, when they get fever, any infections, they must come to the doctor immediately. They should not sit and wait at home. They should always seek earlier attention because of these drugs which reduce the immune system in their body. They can have potentially life-threatening infections. So at the earliest sign of an infection, they must visit a nearby doctor or nearby rheumatologist, take help from medical fraternity because they can progress to life-threatening conditions rapidly. So any patient of lupus who is on immunosuppressive therapy, whenever they have features of any infection, please seek help. In our OPDs, we come across a lot of patients who ask us, is lupus a bacteria? Is it contagious? Is it communicable? Can it spread to other members of the family? So how do you answer that, Dr.
So first of all, it is not an infection that is communicable. That's something that you need to understand. Yes, there can be clusters of the disease in families. Like we've already mentioned, there is that 15 to 20% chance of a genetic predisposition to develop lupus, especially if you have twins and you have consanguineous marriage between close relatives. The chances of lupus do go up. But as such, it's not communicable. And in fact, though sometimes, especially when you have skin involvement You might feel that it's contagious, but it is not contagious. So,
Thank you, Dr. Silas. I would like to say that the World Lupus Day is to create awareness among people that it is not gloomy. The diagnosis of lupus is not bleak, it is not gloomy. There is hope, there is treatment available, there is ongoing research which is bringing about new molecules which can modify the treatment better. So let's encourage the people who are suffering from lupus to tell them that they are not alone. We are here to support you, get you forwards in the life to lead a near normal life.
Many of us are, and our audiences also are unaware of this disease, lupus, and there's a little known fact about it. So thank you to each one of you for just helping us gain understand on this disease. So Dr. Jacob, would you like to add a few points and bring this program to a conclusion?
Yeah, so I think if there's anything we would like to bring across to our audiences today is that lupus or SLE is not a death sentence. The minute one is given a diagnosis of lupus, they are so disappointed and they have a very severe grief response. But we want to just convey a message of hope. Lupus can be very mild and it can over time become serious. So I have patients over the years who've done extremely well with lupus, with good treatment, with good monitoring. I have some patients who've gone on to become engineers. Recently, one of my lupus patients have got admission to a medical school. We've had, all of us have had patients who have had successful pregnancies and are living happy lives. The key message is to seek treatment early and to continue treatment, to be regular with medications and with the monitoring. It's very important to get a rheumatologist to supervise your treatment. You also need your family physician or a general physician to overlook aspects of infection, blood pressure, monitoring, such other day-to-day complications which may arise not directly linked with lupus, but there has to be a good interaction with your physician and the rheumatologist so that you don't end up with excess medications or similar medications with different brand names from different doctors. So it's very important to keep all your caregivers in the loop so that your gynecologist, your physician, your orthopedician, your rheumatologist, and maybe your ophthalmologist, everybody knows what are the drugs you're on and that there is no prescription that harms you in any way. And of course, good treatment will give you a very long and healthy life.
We appreciate each one of you doctors for taking time off your busy schedule and to talk about this disease of lupus. Thank you also for your investment in the lives of people, in your contribution to this profession and your service to the people. Thank you, Dr. Jacob. Thank you, Dr. Silas. Thank you, Dr. Asha.
Thank you.
Thank you for watching this show. Thank you.